I'm going to talk you through the subjective report that you already analyzed and compare it to an objective report, one that you've read already. So here's some biased language. I had a horrible experience at 10:30 a.m. April 29th, 2010, while slaving away on Unit 82 of Anthony Greer Hospital. These are obviously biased language, and here's a more objective statement. I received a needle stick injury 10:30 a.m. April 29th, 2010, while working on Unit 29 of Anthony Greer Hospital in Edmonton. Take a look at this language here in the biased version. I was administering a sedative to a crazy patient. That's inappropriate to call someone crazy when I had an extremely dangerous needle stick incident. Um, extremely dangerous is your interpretation. More objective tone would be, I was administering a sedative to a psychiatric patient when the needle stick occurred. There's a lot of biased language here. Some of it's name calling. Crazy Cliff was totally bonkers. Those are inappropriate. You don't call someone crazy. So it's inappropriate language, especially when referring to a patient. He was out of control, screaming hysterically. These are a bit of an interpretation. He has always been disrespectful of the staff. It's not likely that always is true. That word is generally not true. He hates his fellow patients. You don't really know if he hates his fellow patients or if he is afraid of them. You know, there could be other interpretations. This is an interpretation. He has no respect for hospital property. Again, that's an interpretation. You don't know what his attitude is towards hospital property. Here's a more objective wording. The patient was screaming, trying to hit staff and other patients, and throwing objects. That just describes what you saw happening. My amazingly wonderful coworkers. You know, you may feel like your coworkers are amazingly wonderful and you may really like them, but again, that's biased language. In your nursing report, you just want to be objective. Nurses Kevin Samuel, Rebecca Timms restrained the patient while I prepared the medication. So just describe what happened. Here, the language is biased because it's interpreting action. So the patient was angry at me for giving him a needle. You don't necessarily know that that's what that he was angry, and that's the reason he jerked his leg out of Rebecca Tim's grasp. May very likely be, but it's better just to describe what happened. And then he kicked my left elbow as hard as he possibly could. Well, you don't necessarily know that either. That's an interpretation. And let's look at the objective version. Just as I pulled the needle out, the patient's leg jerked out of Rebecca Tim's grasp and his knee hit my left elbow. So you notice there that the interpretations as to why something happened are not there. Also, some of the language is different. I notice here that there's the word smashed. My left hand then smashed into the needle. Here they just were more neutral in tone by just using a more neutral word like hit. My left hand then hit the needle. Here, there's interpretations as to the supervisor's attitude, the supervisor who really hates me, and the supervisor's motivation. I think she was happy to tell me that the patient tested positive. This is inappropriate to give your interpretation. Just say what happened. I immediately reported the incident to my supervisor, who informed me that the patient had tested positive. Now, let's say the supervisor laughed. You could say the supervisor laughed because that is, an objective statement of something that happened. My supervisor reluctantly gave me permission Again, that's your interpretation. And I can't believe how long it takes to get the results of one simple test. That's not necessary here. It's not describing what happened, it's just describing your own attitude. Better to be more objective. With my supervisor's permission, I went home early. I'm still waiting for the results of the lab test. Since the incident, I have experienced awful burning pain in my hand and anxiety attacks when I have to deal with patients who are going nuts, which is all the patients on our crazy unit. Clearly, this last part here is inappropriate. It's kind of name calling. Um, so it's inappropriate language. But even awful burning pain, just say burning pain. Um, just be a little more neutral in how you describe what happened and your experience. So since the incident, I've experienced burning pain in my hand and anxiety attacks when I have to deal with patients who are agitated. Here's some more biased language. Fortunately, my very sympathetic family doctor. Now, it's nice to say that the family doctor is sympathetic, but again, that's your interpretation. It's not necessary here. And saying that I wish you would make it longer is also not necessary here and actually would put you perhaps in a bad light. So better to be a bit more objective. As a result, my family doctor has recommended I take a stress leave for 1 week. More biased language here. If my hepatitis test is negative, I guess I'll have to return to work on May 15th. You don't need to put in this sense of reluctance. Better again to just be objective. If my hepatitis test is negative, I plan to return to work on May 15th.